just north of Burbank, a little town called La Crescenta. And I've been speaking at my school board and other school boards about the Wi-Fi rollout of having access points in every single classroom of my child's elementary school. And there's 36 kids in my son's class, and they're all going to have pads in their hands, you know, in a few weeks for testing and the whole Common Core curriculum that's rolling out. And
what age?
He's 9. And I haven't seen the correlation made, and from a non-scientific perspective, I'd like to know if I'm on the right path to assuming that, you know, a phone to the head could be equal in terms of danger to a child holding an iPad on their abdomen. And I looked in the new, you know, the iPad warnings that say it's important to make sure the antenna's faced the right direction. I've made the mistake myself when I first got one to hold it upside down, pointed right to me, and the picture corrects itself. I mean, who's going to tell these little girls and boys, make sure you this little black strip, which is the most powerful antenna out of all 5, make sure it's pointing up, everybody. You know, it's very easy to make.
I've got the same, my son's in school right now, and his school just proudly adopted Wi-Fi throughout the whole school. So I'm going to be teeing up a lawsuit against the school industry pretty soon about that. But it's really, here again, it's really hard to prove because it's more diffused, and it's going to be even harder. It's going to take even longer probably. I mean, I'm not an expert or a scientist. You would probably better address this, but it makes sense that since it's more diffused, it's going to take longer to get any type of problems, and it may be 20 years. It took me 20 years before I collapsed in the shower using a cell phone, and that's right up to the head.
Yeah.
So Frank has recently had a number of experiences in Canada on exactly this issue. Toronto has something called Safety Code 6. They've been evaluating it. They were trying to propose an expansion. I think, Frank, you should talk about your experiences there. We should try to get Dr. Joel Moskowitz in the room if we can find him, please.
To my mind, I don't even know why you would even hesitate to stop it, because it's a science experiment. And, you know, I don't know if you've seen the study where children's brains, and there's 70% of the radiation goes through.
Yeah.
I just learned this last night. I thought, I have 2 daughters, I thought they got their ovaries and their eggs when they're in puberty. You know, you're born with them. Mm-hmm. So anything you're doing is going to start harming them from the moment you put that device. So
it's irreparable.
And it's irreparable. So and you know, there's sterility. So there's studies out there that show sterility. There's studies out there that show motility issues. There's studies out, so you know, the World Health Organization has classified all wireless radiation as Class 2B. So the question I ask school boards is to say, would you put lead paint in that room in that kid's school? No, you wouldn't. If there was any DDT in the ground, you wouldn't use it. Well, it's classified the same. So why are we even having this discussion? And we do know that children are more sensitive than adults. So it doesn't belong in a classroom. It doesn't belong 24 hours and 7 days a week. So never mind the fact that we're not educating. It's kind of like, you know, we're getting them on the information highway, and we're not giving them any rules of the road. So that, to me, that's just unacceptable. And the younger the kids are, the more concerned I get about it. So we launched campaigns. We haven't figured out a way to sue them yet. If I could figure out a way, I'd help do that. But it's about educating, and you know, minimally, if you have to do it. We got teachers who are electrosensitive. We have one teacher who wears a mask with iron filings, or not a mask, but a veil, and that's how she teaches her students.
Oh, wow.
She's asked for permission to turn the router off during classroom time when she's not using it, and the board hasn't allowed her to do that.
Same thing.
So it's that bizarre, the approach that they're taking. It's almost like they, so to answer your question, I would absolutely fight this to death.
That's what I'm
because it is your
but
kid's
Frank,
safety.
But Frank, what do you fight it to death with?
Well, here's what we do. Here's what we do is as I said in the other room, you go after the elected officials. So board trustees are like in Canada. I think they are in the U.S. too, right? So they're there to serve, and they are liable. They're responsible. They're a board member. So your job as a board member is to go and do all the due diligence and get all the information out there. And then I think you have a responsibility as a board member to educate and make sure parents are aware. Well, parents aren't informed. They're not. This one that we're doing outside of Toronto, Peel Region, they are not informing, in my opinion, they're not dutifully informing the parents about the potential hazards. They're not doing anything to educate the kids, and they're blasting them. In the old days, they used to put the router in the hallway and they used to run them down. Well, now they got them crisscross. And if you look at the mapping of them, they like one child, you know, if you're in the bad luck chair in the room, you could actually be the center of 4 different Wi-Fi situations overlap, right?
Mm-hmm.
Well, for triangulation.
Yes. Well, it's like by 4. So it is actually worse. So that's what I do. Elected officials first, raise awareness with parents, and go after the boards directly, because the boards can make the call. This one you don't need to worry about the FCC. The board can decide to not do it.
And also, too, I think there's a Health and Human statute that specifically states that kids do not fall under the general public. They're considered vulnerable. They're considered a vulnerable population. So, I mean, to say that it's safe for the general public, that doesn't apply to our children. It just seems hard for me to believe, just from that there's no recourse, just from the simple standpoint that they're subjecting our children to a carcinogen. It's like it should end there.
The name of Darius's blog is Between a Rock and a Hard Place.
Okay.
And the reason that's apt is because this is an example of that sort of issue. We do not have a firm scientific base on which to say that Wi-Fi in schools per se is dangerous. What we do have is the World Health Organization saying in 2011 that wireless radiation from cell phones and other devices should be classified as a possible human carcinogen, right? And most things we classify as a possible human carcinogen, we take steps to avoid. You would not let your kids play with DDT or jet fuel or engine exhaust or other things that are classified like this.
But that's a little alarmist. And I'm just going to bring this up because it's really bothering me. DDT, jet fuel, and lead have toxic effects that are not carcinogenic. That's why you don't let your children play with them. So to make a leap from that to say that these potential, yes, in addition to the toxicity the jet fuel, DDT, and lead have, in addition to that, they may be possible carcinogens. So they're in that classification list. So there'd be more than the lead toxicity that we know about. So we can't make that inference.
No,
There's a
right.
lot of fear that's driving this. We don't know what Wi-Fi does. The microwave radiation of a cell phone to the ear is different than the ambient radiation you might get from Wi-Fi in a room. But not knowing is not reason to assume that it's safe. That's true.
Right, and one of the things that I wanted to clarify, just to see if I mean, a lot of parents that I talk to just think, well, how could something pop, they think of it only in terms of an ambient emission. And I'm trying to tell them that these iPads are two-way transmitters. You bring the connection to your child when they are trying to connect, and that is pulsing back and forth. By itself, okay, yeah, all right, I'm far away from it, and I have established myself by readings that, yeah, you are, the readings go down with distance. But what brings it all together is when my son does this with his iPad, it's here. It's that two-way transmission.
My general advice, and I would ask Dr. Moskowitz to comment on this because he's been looking at it too, is that whenever possible, disconnect from the internet or the Wi-Fi. Your child can use the tablet, but disconnect it, and for goodness sakes, put it on the desk. Never put it on the body of you or anybody else. They're really supposed to be used with a 20-centimeter distance, and they're not used that way, but they are supposed to be. So the issue is, if you have these devices, there's a larger issue, which if I were a parent today, I would want to know the answer to, and that is this. This last month's Scientific American had an excellent article saying that there is no evidence that using electronic media for education improves the educational outcome. And there's some suggestion that it doesn't. Retention is worse. There's something to be said for turning the page, feeling and looking and writing with your hand, particularly for young children. And this rush to make electronification out of early childhood education has no foundation in science. There's no scientific evidence that this is going to give you brighter children whatsoever. And the Korean work is very concerning because the Koreans have diagnosed a category of brain damage, of digital dementia, in kids that are started on these devices when they're toddlers throughout. And the industry correctly sees that this is their market. You see, adults already have all the phones and devices, so now they're going after the infant and toddler market.
One thing that, if I could just say one quick thing, and this is another battle for another day, the reason why I think that they're resistant to even turning off the routers is because that gives us a little bit of power to actually do something that we want done. But if you look further into the Common Core curriculum, the devices that they're going to be introducing, in fact, in Washington State, the parents spoke up and prevented palm scanners from being implemented because they peddled them in there without telling the parents. And they're like, well, we want to, and this could map the vein structure in children's hands. And their reasoning was, oh, well, we want to prevent fraud in our lunch program or some crazy thing. And if you look into the Common Core program in terms of the electronic education, they show you things like facial recognition, iris scanners. They show you posture analysis. They show you pressure-sensitive mice, keyboard mice.
Yeah.
And it's a massive data mining collection on our children. And I didn't want to believe it when I saw it, because I was online and I was researching it, and you can download it. It's right from the Department of Education. You can go to page 44, and you look at these devices, and you'll be appalled. You'll want to disbelieve it on site. But I think it starts with the Wi-Fi, and because it's all part of the Common Core program that all our schools across the nation got suckered into.
Well, we're going to have to adopt you, but we have to return to the press conference.
Sorry.
Because we're starting to, we have an initiative underway with Finland, Canada, Australia, and New Zealand right now, where experts in those countries who are concerned about this are trying to pool information and resources about this spread of Wi-Fi into schools. I have to say that as a scientist, I don't have information about the negative effects, and I don't want to get them. Here's what I want. When I went to visit, most recently, my grandchildren's school, I have been talking with them over the year. They are introducing Wi-Fi to the school. All of the routers are at 14 feet high. And they only are in the hall. There's no router in the classroom. They have it set up. All the computers are wired. They only use wireless to download, and then when they finish downloading, they stop the wireless. If you were to set rules like those, then it might work. But without that kind of rule, this is insane.
They've adopted.
So which one is your grandchildren's school? Where is that?
It's in Pittsburgh.
Oh. Can you talk about the
Pittsburgh,
multiple?
Pennsylvania.
Yes, thank you.
Not local,
Pittsburgh, Pennsylvania, with an H.
Can you talk about the multiple source exposure? You know, I was saying, some gentleman came up to me and he said, "You don't realize the irony of you sitting there with a laptop on your lap with your cell phone next to you." And until that moment, I really hadn't considered the irony. But
yeah, essentially, we're living in a mixture of different forms of electromagnetic radiation, ranging from very high frequencies that we're talking about today, microwaves, to extremely low frequency. Some of the devices, like the AT&T cell phone, are putting out very high frequencies and then pulsing at extremely low frequencies. And extremely low frequency radiation was identified as a possible carcinogen about a decade before radio frequency radiation. So we've known this and recognized this potential risk much earlier. Why? Because it's biologically active. Our cells operate at these extremely low frequencies, so it may be interfering with some of these cellular mechanisms. And there is evidence to actually support that. And then in addition to that, you have high frequency transients coming off of some of our electrical lines, which are concerned to some people, which also appear to affect our biology. So we're living in essentially this vast mixture of electrosmog, which the background levels of which keep increasing over time as we add more and more devices to our environment, from smart meters to Wi-Fi to wireless security systems to cordless phones, and then we buy these, and then the devices themselves are transmitting microwave radiation.
Sure, but let's talk a little bit realistically. The world is, and I use this expression in my book, we are living in a sea of radio frequency radiation that did not exist even 5 years ago. That's for sure. But distance is your friend, right? And there are almost no devices that you hold directly next to the brain or body that are microwave devices except for a cell phone. Okay. That's why Environmental Health Trust and a cordless phone. And that's why, yeah, excuse me.
Tablets and laptops.
No. We don't usually hold a tablet like this. And in fact, if a tablet is to be held like this,
people hold one in a lap.
I know, it's got to be tested. So the point is, the message we need to give people is that distance is your friend. Right? That's the basic message. And putting it right here is 10,000 times less exposure than having it right here. Right? That's the message. And we're not going to be able to put, the genie isn't going back in the bottle. I think Frank's organization is called Canadians for Safe Technology. recognizing that you want to make it safer. But look, where we are with cell phones today is like where we were with cars in the 1950s and 60s. Cell phones need airbags and seat belts. We know they can be made safer because, as Brett said, the patents. They have a number of patents that they have filed to reduce radiation. How do you make a safer phone? You change the antennas, you change the case design, you change the software. It's not that hard. The question is, who's going to go first? Somebody's going to do it. And I suspect, I don't want to put you on the spot here, but Samsung phones test at much safer radiation than the Apple.
Yeah.
Samsung.
There is actually a company in Taiwan, I believe, that manufactures a low-powered wireless communication system, which essentially uses some low-powered Wi-Fi within the building and then has a cellular antenna on top of the building to transmit into the cellular network. And they market they market throughout Asia, mostly to hospitals and environments where they're concerned about the radiation levels because they have sensitive equipment, primarily, not for health reasons,
Right.
but they're marketing all over Asia using this low-powered system. So the technology is clearly doable.
Do you know the
It's
name
just
of
the
that
motivation
company?
has to be there to produce it.
He can give that to you afterwards.
I can find it for you. It's been
Yeah.
a while, but I was told about it by a colleague.
So marketing
who's-
to hospital and what? And what else?
Well, the idea is that you can there are companies that are starting to respond to making devices that emit less radiation. And it's just a question of who's going to go first. And whether Samsung has already started, but there's a big issue in the industry, they don't want to admit that they are making safer phones because the question is, what took you so long? Where were you 15 years ago? We have always known that you could reduce radiation from phones. When did you first learn about this issue yourself?
Oh, I wanted to buy a phone for my wife about a year ago, so I started researching it. And just based on the SAR value, and I understand that the SAR value isn't the best indicator, but it's kind of like a miles per gallon thing. It's at least a proxy. And I found that if I took the lowest SAR valued phone, which happened to be this one model of Samsung, compared it to the highest SAR valued phone, which happened to be the Apple 5, the iPhone 5, it was a 10-fold difference between the lowest and the highest. But that's all public information. There's a couple of websites out there that just post the SAR values. I just thought, well, let me just see what the SAR values are. So there is quite a difference.
Yeah,
and I understand, I've read your paper too, that it's not perfect.
Yeah, and the problem with it, that's a good analogy, except it's like you do the fuel economy test only driving up a steep hill, in which case my wife's Camry probably would perform better than my Prius. And that's essentially what the SAR is doing. It's looking at that peak value as opposed to what your average value might be under more naturalistic conditions.
But I'm really thinking about some of the things that Dr. Balassanian said. We really don't have a foundation in science to advise you how to proceed. All we can say is we know children are not little adults. They need more protection. And exposing them to high levels doesn't make a lot of sense based on what we know. But we don't, should we have more information than that for public policy? I have to tell you, I've worn different hats. I've been a science advisor, I've been a policymaker in Washington, D.C., and it's a tough job. And I do hope that Mr. Wheeler, who is now the head of the FCC, will do the right thing by recusing himself from this decision, because it can't possibly appear to be unbiased given his history. But the bottom line is we really don't have a lot of information that we need. And then you can't make it up.
You know, Pew Research showed that 75% of kids, young teens and preteens, slept every night with a cell phone under their pillow.
So I'm just going to make the point that
Couldn't be worse.
Well, when was this
Lloyd,
research done?
Just a second.
I just want to make the point that I'm not a physicist. I don't know that much about electromagnetic radiation. But when I talk to my radiology friends, they dismiss this because biologically there is no penetrance into tissue. Now,
There's no penetrance into
there's
tissue?
no penetrance into tissue with radio frequency radio waves. But it is a point that with the cell phone in the bra, there's direct contact, and breast tissue pathologically goes right up to the skin. So there doesn't really need to be very much penetrance. But if we think back to the 70s, when TV was becoming very popular, I think there is a psychology of fear of new technology. Don't sit too close to the TV, it'll give you a brain tumor. How often did we hear that? That was not true. That did not happen. Now, we have laptops that we are very close to, and suddenly that whole fear stopped. So we need to look into this. We can't be afraid. We can't start, being terrified that someone has a cell phone close to them or held a cell phone up to their ear to answer a phone call. What we know biologically is that there isn't enough penetrance, and we haven't been able to find a cell signal or some sort of cellular mechanism to explain these results. Once we find the results and we've established any reproducible experiments, then we can start figuring out how this works. Then you have a basis for public policy. But in the meantime, we should be cautious because it is a new technology. We don't know everything.
Well, Suleiman's research does suggest that you're having an effect to the physicists. Why don't you comment on this?
Also, I asked one of my colleagues from the radiology, and then he's told me the same as you said. There is no side effect of the non-ionizing radiation to tissue. That means it's very safe. But at the moment, we are working with the radiologist, chief of the Department of Radiology. We are conducting on the human subject. I hope this study will be ended by this month. And then we use two groups. One group talk at least less than half hour per day. Second group use the cell phone more than 1.5 hour per day. And then we are looking at the brain of the subjects, and then to measure especially the hippocampal region, what happened, what type of the effect is seen. This is my
interesting.
question.
So how are you measuring the brain?
This is my sentence about the radiologic aspect. And in tissue, we have done more than 6 or 7 research. Already we exposed the animal, and then each animal received the standardized radio frequency, and then we see the number of cells in each organism decrease enormously. And also this data is evaluated and supported by the behavioral test. If you expose the animal by radio frequency, these animals cannot learn easily, and they cannot find anything is hidden somewhere. It's a very real situation.
So, Ron, these are effects.
All of them
They're
is
not,
and also,
and you saw
and also we quantified all cells by means of 3-dimensional approach. If you cut some section and use the 2-dimensional, your result might be incorrect, since you cannot talk the tissue the same language.
With respect, an MRI machine uses radio frequencies.
No,
Yes, it does.
magnetic.
It uses a very high static magnetic field, several Tesla, depending on the model.
Yeah.
And then the way you get the scan is every atom is lined up magnetically, rather than being randomly in different directions because of the big static field. Then you use radio frequency fields in the megahertz range to see how these things move. And then for the computer scan, you get a very detailed image of the interior of the brain or the interior of any part of the body. Radio frequency do penetrate completely through the body.
Well, they're being used to, and right now, I visited with people at Dartmouth that are still convinced that you can use it to try to image breast cancers. And there's, as you know, there's a big debate about this, but they're still funded by NIH to try to do that. I think we don't want to put you on the spot, Dr. Balassanian, but frankly, the work of Hugh Taylor and Suleiman Kaplan, they're showing biological effects and structural effects. They're showing behavioral effects using standardized models for measuring behavior in mice. and there's a statistically significant difference in the outcome of the behavior. And Dr. Kaplan is showing effects in the hippocampus and in the dentate gyrus and Purkinje cells in terms of counting them. So those effects are obviously suggesting that there's something that got through the body. I think, Joel, you had a few...
Yeah, well, just in terms of physical evidence, the SAR test is based on a simulated human brain and body. They're simulating human tissue using water and a salt and sugar or some kind of mixture. They're simulating body tissue, and they're taking measurements within the body and within the head. So there's clearly penetration occurring in the SAR test, which is what they're measuring.
It goes in 3 centimeters, so it does get in. The idea that it doesn't get in at all it's not true. I mean, the person you're speaking to doesn't know. The SAR testing is standardized measurement of absorption into the brain to 2.5 to 3 centimeters. That's what it is. And it's standardized by the FCC.
What about the work of Dr. Martin Blank on the mechanism of effects? Can you say something?
Dr. Blank has shown in a series of elegant experiments that you get a stress response and you get the proteins that form. That's what Darius was suggesting with that big complicated slide, that it's the stress response. You were suggesting that the thing that makes this so hard is that we're looking at so many different endpoints. We're looking at the breast, we're looking at sperm. What if in all of them you could show an effect on the calcium channel, a same kind of effect on divalent calcium cations? What if you could show an effect on the production of stress proteins? No matter, dealing with these different things. That would be the kind of thing.
Cellular mechanism that
Right.
explains
So
different results.
we need to start to ask that question, okay? And back to the children in schools, my point is, I don't want to experiment on my grandkids. I don't think we should. And I think we ought to err on the side of caution. And it really is challenging to think of any example of public policy where we've really done that successfully.
And I think the core of the root of the problem is the fact that the money has already been spent. The money's already been spent on this program, so to retract it means the government will take the money out of the school budget. So like all the school boards that I've talked to, they're hamstrung with this reality. Like, what else can we do with them? I mean, the money's been spent.
Where's your school board?
I'm at Glendale Unified School District, which is near Pasadena. And I'll be speaking to Fullerton tomorrow, their school board, and you get 5 minutes to speak. It's really crazy.
You get it's sort of the infrastructure problem, isn't it? Once you get the investment in the infrastructure, what are you going to do? I mean, I thought it's nuts to give a bunch of kids iPads because they break. I mean, they're glass, for goodness sakes. But this is a very serious problem, and I think that coming up with some basic messages, distance is your friend, disconnect from the internet whenever you can, and wired is always better than wireless wherever you can get wired. Ellie?
I have a question for Frank. How do we get the industry to work with us? Why would they, what would be their incentive to do so? I know that's a tough one.
Well, no, it's my experience. I think the industry responds to either an opportunity or a threat. And so if they think there's an opportunity to gain share and they're responsible to their shareholders first and foremost and arguably only. So is there an opportunity that they can grow share because of something that they can produce a safer phone that more people will use? But there's nothing to suggest that the growth in this technology is going to slow down. So then is there a competitive threat where there's one competitor that's going to do something that they have to cover? I don't know which way to go.
So it sounds like we need to talk one manufacturer or carrier to doing something right.
One of the big ones.
And then the others will.
Well, you need one that has to be viewed as a threat, right? If you could get a small and up and coming or that was well funded, that could
I know. I
take
think it
market
was
share.
last year. Didn't Motorola put in their shareholder information? They listed the lawsuits, I believe, to their shareholders.
Well, they usually have to. And the other issue is I've heard the insurance companies are refusing to insure these cell phone providers anymore, and that's not indicative of where this is all going, because they're looking at what happened to these companies with asbestos and tobacco, and they're saying, hey, these companies are going to go bankrupt, and we're going to be fitting the bill because we're insuring them. And so now they're not going to be able to get insurance, and I don't know how they're going to handle that.
In the preface to my book, Disconnect, written by David Servan Schreiber, he describes the night we had dinner, and I asked him, what the hell were you doing? He answered his phone and put it next to his bed. And he said, well, there's no problem. And I said, wait a minute, do you know that cell phone companies cannot buy insurance from health damages from cell phones? He did not know that. And I said, and did you know that all phones today come with warnings that tell you to keep the phone some distance?
And that brings up another legal issue. These warnings are really contracts of adhesion.
What does that mean?
A contract of adhesion, like the prime example of a contract of adhesion is when you go in a parking garage. You get a ticket, you punch the button, because you're already committed to going there. You push the button and this little ticket pops out, and then you get hot from the rear and you got to pull forward, and you look at your ticket and it says, you know, we're not in microscopic writing, you have to have a nuclear magnifying glass to read. And then, you know, you shove it in your pocket, and then something gets stolen. You go to the guy, and he goes, "Oh, see the contract you acknowledged here? That's called a contract of adhesion. That wouldn't hold up in court." And this microscopic writing, if you really push it in court, probably wouldn't hold up either, because people would say, "Who's going to read that? Who's capable of reading that?" And the jury would look at that and try to read it themselves and say, "Well, we can't read it, even like in front of our face. So how can someone? And who's going to actually read that small micro pen anyway?" So it's obviously there just to cover their butt for a lawsuit. Because when they get sued, they're going to say, "Well, we warned them in the pamphlets."
They didn't properly warn, is what you're saying.
They didn't properly warn them, and it's called a contract of adhesion, where you're adhering something to something they haven't really agreed to. In order to have a contract, you have to have a meeting of the minds.
Well, we're going to try
And
to
there's
take
no
the
meeting
show
of the
up a
minds
little bit.
when you have that.
So it's probably not going to be BlackBerry.
Coming back for a moment to the idea of a safer cell phone, Volvo created a safer car. They had a nice niche market, and people that were really concerned about the crashability of a car, particularly if they had young kids, would buy a Volvo. That's what needs to happen with a safer cell phone. Once that leads, you know, I don't know the exact history, but I suspect that airbags came about because Volvo was offering them first. I don't know if that's really true, but then that sense of there is safer things to do. Once that's in the public mind, then there's a lot more demand for safer things.
Well, I have one kind of really idealistic, impractical idea, right? And it's late, and we're going to wrap up now, so I might as well throw it out. I think we need a Truth and Reconciliation Commission on toxic hazards. What I mean by that, and inspired by Mandela, I spent some time in South Africa, is that we know that industry has a lot of the information, and they certainly have the expertise. And we have people there who are reaching out to me and others who want to do the right thing. But the lawyers don't want to let them do the right thing, because then they will be admitting liability for the fact that they could have done it sooner. What took you so long, right? So if you created a Truth and Reconciliation Commission on toxic hazards, and I mean chemicals as well as cell phone radiation, microwave radiation, then you would say, okay, industry, you tell us what you have. You agree to pay the health damages for Brett and Alan, and pay something for the suffering, for what they've gone through. But you won't have punitive damages for future cases if you come through and tell us what you know now. And at least it's worth a try, because we're not getting anywhere this way, and they hold all the cards. I mean, we've been able to put this information together because of brave and important research by Dr. Kaplan, what Joel Moskowitz is doing and putting information out, and you have to look at his blog and the statements. It's very useful information. What we have as well on Environmental Health Trust, but we're really, it's a little bit like someone said that we're peeing in the ocean. We need to make these changes, and hopefully something like that might work.